the conduct of this hearing. First, members should keep their video feed on as long as they are present in the hearing. Members are responsible for their own microphones. Please also keep your microphones muted unless you are speaking. Finally, if members have documents they wish to submit for the record, please email them to the committee clerk, whose email address was circulated prior to the hearing. Without objection, the chair is authorized to declare recess at any time. Good morning, and welcome to this Environment Subcommittee hearing on coping with compound crises, extreme weather, social injustice, and a global pandemic. I would also like to welcome our esteemed panel of witnesses and thank them for their participation. I'm thrilled to have two women at the top of their fields here with us today. This hearing is very timely as this is National Preparedness Month, which is recognized every September to promote family and community disaster planning. This year's theme is Disasters Don't Wait, Make Your Plan Today, which is an especially important reminder as our country deals with the COVID-19 pandemic and devastating extreme weather events. 2020 has been a challenging year in so many ways. A record-breaking number of extreme weather events, a national reckoning with systemic racism, and a global pandemic. From January to July, there were 10 weather and climate disasters costing over $1 billion each. And this number does not even include any of the devastating wildfires that continue to burn across the West Coast or the Midwest derecho that destroyed homes and cornfields across Iowa and other states, nor the extremely active Atlantic hurricane season that has wiped out entire towns and brought unsurvivable storm surge across the Gulf Coast region. This season of climate and weather disasters compound the ongoing COVID-19 pandemic and continued social and environmental injustices. Many communities are grappling with multiple risks at once: the dueling threat of wildfire or hurricane evacuations during shelter-in-place orders, the legacy of historic redlining while trying to rebuild post-disaster, and farmers already reeling from the economic fallout due to the pandemic, losing their crop to severe storms. In my home state of New Jersey, where low-income families and small businesses have been particularly devastated, we are all hoping we don't have another Hurricane Sandy during this abnormally active Atlantic hurricane season. As climate change continues to cause more frequent and severe weather events, we must be ready to face multiple hazards at once. Whether it is several storms in a row, the everyday impacts of climate change on vulnerable populations, or an extreme weather event during a future pandemic, it is extremely important that we understand how these compound events interact with each other in order to better prepare for, communicate about, and respond to them. There remains much uncertainty about the most effective risk communication methods during a public health crisis or extreme weather event, especially for vulnerable communities. Understanding how people perceive risk and respond to warnings, especially when faced with multiple threats, is essential to informing emergency planning and response. But the federal government lacks robust funding for emergency management research. We will hear today about how improved coordination and additional interdisciplinary research and risk assessments are needed to bolster our emergency management capabilities. When disaster occurs, being able to collect data, particularly on social and behavioral responses, in a timely manner is crucial to understanding immediate impacts to communities. The National Science Foundation's rapid funding mechanism provides funding for proposals with a severe urgency, including research on natural disasters or similar unanticipated events. This serves as a great model for other agencies to support research related to environmental and public health crises that require a rapid funding mechanism. As we enter an age where the impacts of disasters will continue to be exacerbated by stressors such as climate change and social injustice, it's imperative that Congress works to improve our country's response to these disasters. Investing in interdisciplinary and rapid funding mechanisms for research into these topics, especially as we expect to see more compounding crises, will be vital to our success in mitigating the impacts of these disasters. I look forward to today's discussion with our witnesses to identify how this can help address some of these critical research. And I think somebody's microphone's on. If you can make sure you're on mute and not speaking. Thank you. At this time, I would like to enter into the record a letter from the Union of Concerned Scientists expressing support for this hearing and emphasizing the importance of discussing the intersection of systemic racism, the climate crisis, and the pandemic. UCS's recent research has found that communities will increasingly face multiple crises at once as climate change progresses, and that bold action is needed to limit these future impacts, especially for low-income communities of color. So we are honored to have the full committee ranking member, Mr. Lucas, with us today. The chair now recognizes ranking member Lucas for an opening statement.
Thank you for holding today's hearing, Chairwoman Cheryl. Today's the last day of September, which means we're 3/4 of the way through 2020. Today's hearing will focus on a number of factors which have combined to make this an especially difficult year for our country. Some of these challenges are new and some have been ongoing. Unfortunately, extreme weather events are not new, although there's been a higher number of these events this year. We've seen an unusually active Atlantic hurricane season with 23 named storms to date, and still 2 months to go. Communities along the Atlantic coast have been battered by strong winds, heavy rain, and severe flooding. One of the many images future generations might remember this year were by pictures of communities across the West bathed in orange due to the prevalence of wildfires across many Western states. More than 7.5 million acres have burned, which is well above the rolling 10-year average of wildfire damage. Entire communities in states like California and Oregon have literally burned to the ground. Better forecasting and public warning of extreme weather events has long been a focus of this committee. And I'm proud to have introduced the Weather Act of 2017, which directed NOAA to address how we can better forecast the occurrences of extreme weather events and how we can help the public be better prepared in the occurrence of these events. We have made strides in these efforts, but we still have a long way to go. A global pandemic has made forecasting even more challenging. We've heard from NOAA about the steps they have taken in order to ensure the continuality of operations to help warn Americans of impending extreme weather events. Unfortunately, a pandemic does not stop hurricanes, tornadoes, and flash floods. I think I speak for all of my colleagues here when I say how much we appreciate our forecasters for continuing this valuable work under challenging circumstances. The committee's heard from federal agencies and research universities about the impact of COVID-19 on our country's research and development efforts. The message was clear. Our success depends on science. We must continue to move forward on scientific innovation and support our research enterprise. I thank our witnesses for being here today. I look forward to hearing from our witnesses about what lessons we can learn from this year and how we can utilize our federal research and development efforts to prepare for future events. Thank you, and I yield back, Madam Chair.
Thank you so much. We are also honored to have the full committee chairwoman, Ms. Johnson, with us today. The chair now recognizes the chairwoman for an opening statement.
Thank you very much, Chairwoman Cheryl, for holding this important hearing today, and good morning. And thanks to all of our witnesses for being here today. We are in an unprecedented moment in our nation. We have previously discussed the intersection of COVID-19 pandemic and extreme heat on environmental justice communities. These last few months have laid bare how these communities are disproportionately impacted by the COVID-19 pandemic due to decades of social injustice. These same communities are often disproportionately impacted by extreme weather events that are exacerbated by climate change. While we're working diligently across the globe to bring this pandemic under control, we cannot forget that we're just starting to address the impacts of climate change on our daily lives. These impacts are undeniable, and the increasing evidence of extreme weather events is a very visible example. In 2020 alone, we've seen unsurvivable storm surges due to hurricanes in the Gulf Coast, the devastation of Iowa's corn crop due to the Midwest drought, and the largest wildfire in California history. As communities across the country grapple with these intersecting crises, it is clear that these crises are impacting not only our citizens' physical well-being, but also our mental health. The ongoing stress and trauma due to the pandemic and for some communities outweighs the weather. As a former chief psychiatric nurse at the Veterans Hospital, I've seen firsthand how trauma can affect mental health. The types of compounding crises we are currently seeing will have both short-term and long-term effects on our communities. It is important that we work to collect the data and conduct the research that is necessary to understand the impacts of this trauma. I look forward to today's discussion with this panel of expert witnesses to better understand what research is needed for us to improve our preparation for, communications of, and response to compounding disasters. Thank you, and I yield back.
Thank you, Madam Chairwoman. If there are members who wish to submit additional opening statements, your statements will be added to the record at this point. And at this time, I would like to introduce our witnesses. Dr. Roxane Cohen Silver is a professor of psychological science, medicine, and public health at the University of California, Irvine. Her work focuses on traumatic life events and deals with personal losses as well as collective traumas. The themes of her research are the effects of collective traumas, community resilience, and the role news and social media play in transmitting the stress of disasters. Dr. Silver has researched the mental health impacts of the September 11th terrorist attacks, the 2013 Boston Marathon bombings, Hurricanes Harvey, Irma, and Michael, and the Ebola public health crisis. Most recently, she has completed a national study of the effects of the coronavirus pandemic in the U.S. Unfortunately, our second witness, Ms. Colette Pichon-Battle, who is the founder and executive director of the Gulf Coast Center for Law and Policy, is no longer able to testify today. Our final witness today is Dr. Samantha Montano. She is an assistant professor of emergency management at Massachusetts Maritime Academy and a self-described disasterologist. Her research analyzes different aspects of emergency management, such as nonprofits, volunteerism, informal aid efforts in disaster, and the intersections of disasters with climate change, gender, and media. She began her career in disaster management after working for nonprofits on recovery efforts following Hurricane Katrina and the BP oil disaster. Our witnesses will each have 5 minutes for oral testimony. Your written testimony will be included in the record for the hearing. When you all have completed your spoken testimony, we will begin with questions. Each member will have 5 minutes to question the panel, and we will start with Dr. Silver. Dr. Silver?
Yes, good morning, Chairwoman Cheryl and members of the subcommittee. Thank you for the invitation to speak with you today on coping with the trauma of 2020, a year of grave stress, loss, and disruption for the United States. I'm a professor of psychological science, public health, and medicine at the University of California, Irvine. And for over 3 decades, I have studied the psychological impact of community disasters, such as firestorms, mass violence, hurricanes, and infectious disease outbreaks. Almost all of my research over these years has been funded by the National Science Foundation. The year 2020 has been marked by unprecedented compounding traumas, as I will briefly discuss, but have described in more detail in a paper that will be published next week in the journal Nature Human Behavior. These catastrophes have cascaded one to the next. Next slide, please. And individuals across the US have concurrently grappled with direct exposure to these events and watched them unfold in real time in the media. Research I have conducted over the past several decades strongly suggests that the mental health consequences of direct and media-based exposure to these compounding stressors may be profound. This year has taxed our capacity to cope with the most vulnerable groups in our society at greatest risk. Policymakers must act to ease the burden of trauma to protect the public's mental as well as physical health. Last week took us past a sad milestone. Over 200,000 people have now died of COVID-19 in the United States. The severe restrictions implemented to limit the spread of infection left thousands of businesses closed and millions of Americans unemployed. These crises hit low socioeconomic status and minority communities especially hard, highlighting economic and racial inequalities in healthcare in our country. With the pandemic and economic recession as a backdrop, the absence of distraction and easy access to graphic videos of the deaths of unarmed Black Americans led to protests and ongoing social unrest. And over the past few months, the U.S. has faced extreme weather events, including devastating hurricanes and disastrous wildfires that require evacuations that have been made more complicated during a pandemic that requires physical distancing. Together, the combination of medical, economic, racial, and climate-based catastrophes highlights the need for serious attention to be paid by both public health officials and policymakers of the implications of cumulative trauma exposure. In March, next slide please, my colleagues and I published a commentary in which we used the research we have conducted on collective traumas over the past 2 decades to predict that widespread media exposure to a crisis like the COVID pandemic could amplify the distress people felt in response to this public health emergency. In fact, our past research suggested that repeated media exposure to COVID-19 news could lead to increased anxiety. While we predicted negative effects of the media to the events of 2020 based on our earlier research, it was critical to conduct research on the pandemic specifically. However, the challenges of obtaining funding quickly in the aftermath of collective traumas often lead to a lack of early studies of large representative samples. Fortunately, because the National Science Foundation offered many COVID-specific rapid grants, which enabled research funding for high-quality science, my colleagues and I were able to conduct a methodologically rigorous study of a national sample of 6,500 adults in the U.S. that began March 18th. The first report from our study was published last week in the journal Science Advances. We started our project just as the pandemic unfolded, beginning when there were 190 reported COVID-19 deaths in the U.S. to over 13,000 deaths less than 30 days later. We found that as the weeks went on and the cases across the U.S. grew, so did rates of acute stress and depressive symptoms. Will we survive the trauma of COVID-19 and the cascading tragedies that have followed? As I wrote in an editorial in Science in July, I believe that we will. This is not to minimize the seriousness of the tragedy in any way. We do not know how long the pandemic will last or how bad it will get. But my decades of research on trauma make clear that people are extremely resilient. Although the timing of the end of COVID-19 remains unknown, I believe that most people will get to the other side of this pandemic, recognizing strengths and coping skills they did not realize they had. Rigorous research by psychological scientists can offer understanding of human behavior during crises to minimize future waves of infection and death. This concludes my testimony. Thank you.
Thank you so much. Next, we will hear from Dr. Montano.
Thank you, Chairwoman Cheryl, and members of the subcommittee for the opportunity today to testify on issues related to coping with compound crises. As the Chairwoman stated, I currently serve as an assistant professor of emergency management at Massachusetts Maritime Academy. I have a doctorate in emergency management from North Dakota State University and over a decade of emergency management experience in the field in research and in science communication. For several years, there has been mounting evidence that the various components of our emergency management system are not keeping up with our needs across the country. In 2016, some national disaster nonprofits began talking about volunteer and funding fatigue. In 2017, FEMA struggled to meet the needs across the country in the wake of Hurricanes Harvey, Irma, Maria, and the California wildfires. This year, when the pandemic began, every emergency management agency at all levels of government activated simultaneously for the first time in U.S. history. Given our reliance on mutual aid between jurisdictions during times of crisis, the pandemic revealed the interconnectedness of this system and reinforced concerns about its capacity to meet the nation's growing needs. Research suggests that 2016, 2017, and 2020 are not outlier years. Rather, they represent just the beginning of what is to come as the consequences of the climate crisis begin to manifest and collide with deferred infrastructure maintenance, social inequality, and decades of development decisions that have not accounted for hazard risk. Our system was not designed to manage a pandemic of this scope and scale, nor was it designed to manage the increasing number of disaster impacts across the country, and it's certainly not ready to meet the needs of the future. Our current approach to emergency management is especially insufficient for Black, Indigenous, low-income, and other marginalized communities. Decades of policy decisions have funneled these groups into especially vulnerable areas. Not only are these communities more likely to live in more physically vulnerable places, but they are also less likely to have the resources to be able to engage in pre-disaster mitigation and preparedness activities that would minimize their risk. When a hazard does occur, these communities experience disproportionate impacts and are less likely to have their needs met by existing recovery programs. We need to urgently change our emergency management approach to one that is proactive, not reactive, one that centers environmental justice, and quickly meets the actual needs of people before, during, and after disasters. Empirical research must drive these changes. Scholars in many disciplines produce research that is fundamental to our understanding of disasters and their effects. But there is a particularly important role for the discipline of emergency management, which studies how humans and their institutions create, interact, and cope with hazards, vulnerabilities, and associated events. Historically, research has not been well integrated into emergency management policy and practice, despite its undeniable value to both. We need not only to ensure that future policy is built on empirical research, but also that there are sustained funding mechanisms in place to support emergency management research specifically. Currently, emergency management research is underfunded, which hinders our ability to inform emergency management practice and policy. Disasters do not happen in isolation from one another. We must address not only our nation's readiness to manage a Hurricane Harvey, Maria, or a pandemic, but also our capacity to manage multiple threats at once, because that is our reality. As I testify before you today, people are struggling through disaster and its aftermath. Gulf Coast residents have had to manage a barrage of hurricanes, as West Coast residents have had to manage constant wildfires. Parts of the Southeast are rebuilding after spring tornadoes, while Midland County, Michigan recovers after dam failures, and communities in Iowa pick up the pieces after a derecho. People in all parts of the country are engaged in long-term recovery efforts, especially Puerto Ricans who 3 years post-Maria are still waiting for all the assistance promised by the federal government. In states, territories, and tribal lands all across the country, people are fighting against the repercussions of systemic racism and social injustice, all while a pandemic that has killed over 200,000 Americans persists unabated. These recent examples of trauma, loss of life, and destruction cannot be separated from each other, and emergency management is on the front lines of addressing them all. Thank you for your attention to these important issues. I look forward to answering any questions you may have.
Thank you so much. At this point, we will begin our first round of questions. The chair recognizes herself for 5 minutes. So just to begin with, Americans, I know, are no strangers to dealing with extreme weather events, but during the current COVID-19 pandemic, it's really caused us to rethink our traditional methods of responding to disasters. In my own district, we recently had a hurricane come through, and with the power outages, there was a constituent who was in the street crying, really, and the mayor came up to her and said, you know, what's happening? And she said her elderly parents were stuck in their home without power. We were facing some 90-degree temperature days. And she was afraid to bring them to her home because she has teenage children and she was afraid they would give her 90-year-old parents coronavirus. There's also my in-laws who are in California right now facing the wildfires. I'm worried about their safety, and normally I'd bring them over to stay with us in New Jersey, but like many families all over the country, you know, I don't think they want to get on an airplane, and I don't blame them. So these decisions aren't made lightly, and Americans are increasingly forced to decide which crisis is the one they have to respond to. So Dr. Silver and Dr. Montano, for families and first responders, like, how are we working to understand the new set of challenges that come with responding to the compounding crises of extreme weather during the pandemic?
Thank you for that question. You know, what you described is definitely an experience that I think many families across the country right now are trying to manage. You know, everything we do in emergency management requires people to be in close proximity to one another. And that has meant that every facet of emergency management has been affected by the pandemic. As you noted, response efforts have had to change as communities are rethinking how to utilize, you know, virtual emergency management operation centers, how to run shelters without starting an outbreak. And certainly we see that families are trying to make the best decisions they can with the resources that they have to prioritize those risks. There are a number of researchers across the country that are working on studies looking at how these decisions are being made and what it potentially means for the future. There is a program called Converge COVID-19 Working Groups that was supported by NSF through the Hazard Center at University of Colorado Boulder. And there are a number of publicly available research agendas that researchers have that are kind of in the process of seeking funding to help answer those questions.
Thank you. And Dr. Silver, did you have anything to add?
Just that while it's extremely important that we use science to help us make decisions, as you can imagine, we really have not been in this kind of situation before. And therefore, we are really stuck with not having adequate science to help guide us. As you correctly identified, these are competing mitigation strategies, and one needs to leave the area in which one might be threatened, but in doing so, then one typically goes into a shelter that packs people in. So we really have not been in this situation. We are not adequately prepared, and our research now hopefully will help us when the next set of compounding crises hits us. And most scientists do say that we are in for this kind of a season of compounding crises in the future. This is the first time for our country right now, but I think that it's extremely important that we have research that will help guide us in the future as we hope, and that we will be much better prepared in the future. At least that's my hope.
Well, thank you very much. And my time is about to expire, so I'll now recognize the ranking member of the full committee, Mr. Lucas, for 5 minutes.
Thank you, Madam Chairman. And Dr. Montano, I'd turn to you first. Fundamentally, why do people still ignore evacuation mandates? In Oklahoma, we have the National Weather Service Storm Prediction Center, which is conducting research to try to increase tornado prediction times. But even if we were to increase the warning to a 45 minutes to an hour time frame, what reasons do people have for ignoring it and staying in their vulnerable homes?
Thank you for that question. We have a fair amount of research on this actually across a number of disciplines that can contribute to our understanding of how people are making protective action decisions in the midst of a response. Generally, we pull here from 3 disciplinary purviews. So we have psychologists that are contributing an understanding of how people are perceiving risk. We have communication researchers that are looking at the actual ways that people are receiving alerts through a phone or an outdoor siren. And then we have sociologists who are helping to describe the human behavioral aspects of this. One thing that we do in emergency management is pull from across all of those different disciplines to understand how the findings of their research can help create a cohesive model for understanding those warning decisions. And what we see when we do that is that, there are issues with people actually receiving warnings in terms of actually getting that alert on their phone or actually understanding how to interpret the message that has been given. We see that there may be educational issues, so they might not understand the risk and may not understand the actual actions that need to be taken. And then kind of a third category is whether or not they actually have the resources to take action. So if you tell someone to evacuate for a hurricane, but they don't have their own transportation and are unaware of public transportation opportunities, then they may not take that action. So really we need to be looking across those different disciplines and finding ways to make sure all of that research is incorporated into our approach.
But in the research you have access to, is this a problem, an issue that in a societal way as a whole or a part is becoming more complicated or less complicated? There's a tendency out there right now to be distrustful of government, of the internet, of everybody and everything. But a lot of these efforts represent their own best interest. We're really all together trying to help people. Do you see a change in the patterns of response by people?
Certainly trust is a major factor here as well. I'm not aware off the top of my head of recent research from this year that has addressed that change. I think that it is something that several researchers are looking into, though. I'm not sure that those findings are available yet.
Continue with you, Doctor. You mentioned a common recommendation to restore FEMA to an independent cabinet level agency. And I, of course, understand your area of expertise is emergency management. But what role does weather prediction, and you can tell coming from the east side of the Rockies and the Southern Plains, I'm very sensitive about weather too. What role does weather prediction have in our responses to emergencies? And do you believe an independent cabinet level NOAA would enable a more proactive rather than a reactive approach, as we've been talking about here today?
Potentially. My focus is really on FEMA more than NOAA. So independent cabinet level FEMA is definitely something that has been suggested by disaster and emergency management experts for a number of years. And certainly to the extent that NOAA is impacted by politics, we would want to work against that, as certainly the research brings up that issue of trust and people actually listening to those warnings.
One last question, and then I'll yield back the balance of my time. Along the theme of what we're talking about now, we have a variety of challenges in the country, and not just new challenges. I represent a part of the world that was the abyss of the Great Depression, the Dust Bowl of the 1930s, which represented policy mistakes that went all the way back to the Homestead Act of 1862. Well-intended, and it worked well in the Midwest, but different soil, different climate, different circumstances in my part of the world made for a challenge. I guess my question to you is, thinking about the issues, expand for a moment on the kind of research that's needed to ensure effective and efficient approaches. Is it sociology? Is it environmental? Is it, just expand for a moment, because we are the research committee of the United States House.
And if you could keep your response brief, the gentleman's out of time. Thank you.
Yes, definitely. Well, we need all disciplines to be involved in doing this research. Historically, there has been a greater emphasis on the physical sciences, earth sciences. We've more recently seen more of an emphasis on social sciences, and that does need to continue. And then, as I would reiterate, is that emergency management research specifically does need to have that investment.
Thank you, Madam Chair. You back.
Thank you. And I now recognize the chairwoman of the full committee for 5 minutes.
Thank you very much. We'll start with Dr. Silver. What should our research and data collection priorities be if we are to understand and address the impacts of the trauma that I spoke about in my opening statement? And who should take the lead on that data collection and research?
Thank you very much for that question. As I mentioned, the National Science Foundation enables a mechanism unique to the federal agencies to allow researchers to propose very quickly projects that are then funded through the RAPID mechanism. And across my career, I have been fortunate to receive between 8 and 10 of those grants that enables me to start studying people at the very beginning of the crisis. And I would very much encourage any future research to be what we call longitudinal. That is, start in the immediate aftermath of a disaster and follow people over time. What's even better, however, and this is research that I have been trying to conduct for many years, is to identify communities that are at risk of a disaster before it happens. Develop research teams, interdisciplinary research teams that could be activated. We know that certain communities are going to be at risk for floods every year. We know that certain communities are going to be at risk for firestorms every year, and similarly for hurricanes. And what we can do is identify communities, enlist people to be in a research project before the disaster hits. We can understand what kinds of decisions they are making prior to the disaster, what media they're listening to, whether or not they're trusting the communicator. And then once the disaster hits, we can follow people over time. And that is the best kind of research that we can do on these crises. One other very, very important message is that we must conduct methodologically rigorous research. That is, using the best samples, using what the scientists to help us identify the best samples, so that we can make recommendations based on truly representative samples of people across the country that can help us in the future.
Thank you very much. Any other witnesses want to add to that? Okay. Environmental and health research within the federal government is typically siloed, with NIH usually conducting health research and science agencies such as NSF, DOE, NOAA, and EPA conducting environmental and social science research. When it comes to diseases, climate change, and extreme weather, there's much overlap between public and environmental health, especially in the social science domain. Thus, interdisciplinary research and funding mechanisms are needed. So I'd like each of the witnesses to comment. In your work, are there sufficient funding mechanisms for research in this interdisciplinary space? And how federal agencies break down disciplinary silos to obtain a stronger understanding of social and institutional dynamics following extreme weather events?
I'd like to take that question first, if you don't mind, and I'm going to use the example of the September 11th terrorist attacks. Unfortunately, because there were very few mechanisms to get funding shortly after the September 11th attacks, my colleagues and I, remarkably, were the only team that obtained funding from the National Science Foundation within days of the 9/11 attacks and were able to follow several thousand people for several years, many years, in which we could look at the impact of the 9/11 attacks on both physical and mental health. The challenge has been getting the funding out quickly, and at this point, almost none, in fact, perhaps only one research project that I have conducted in over 40 years has been funded by the NIH, because there has not been a mechanism to get the funding out to me quick enough to be able to do my research. The National Science Foundation, in contrast, has specifically developed a mechanism, used to be called something different than it is now, which is now called RAPID, and that was implemented very quickly. That mechanism was implemented very quickly after COVID. Over 900 proposals were funded via the RAPID mechanism through the National Science Foundation. The NIH did not have that flexibility, that ability to speedily get funding out to researchers. And this is a very, very serious problem.
Thank you. And the gentleman's time has expired. Thank you, Madam Chairwoman. I now recognize Representative Babin for 5 minutes.
Okay, thank you. Thank you very much, Madam Chair. I want to thank you, and as well as our witnesses today. I have the great honor of representing Southeast Texas, which unfortunately has been the center of devastating floods that seem to come annually now. 3 years ago, Hurricane Harvey dumped the single largest amount of rainfall in the recorded history of our country in my district. Since then, we have had several hurricanes and tropical storms that leave much of Southeast Texas underwater. This sort of reoccurring devastation not only upends the lives of thousands, but has enormous implications on our federal budget. These disasters every year leave the taxpayers responsible for the colossal bills that are needed for our recovery. Investing money in mitigation efforts is an incredibly wise investment that will save billions of dollars every year in damages. So my question to Dr. Silver and Dr. Montano, since Hurricane Harvey, there has been an effort to promote resilience to help communities be better prepared for future extreme weather events. So I would ask both of you, to what degree should the federal government be involved, and how much responsibility should the states have in these projects, and what is needed to rebuild even faster than what we're seeing? Thank you.
Thank you. I'll take that question first. I have experience doing research in Southeast Texas, so I'm well familiar with the particular challenges of those communities. What we're seeing in multiple places around the country, but specifically Southeast Texas, is that the next disaster is happening before people can get through recovery. And some folks are really getting stuck in this cycle of recovery where they can't rebuild before the next disaster comes. When we look at our approach to recovery in the United States, it's one that uses a limited intervention model. The government is intentionally limited in their involvement, and folks are reliant on their own resources, on insurance, and also the nonprofit sector. As I mentioned in my opening testimony, there are signs from the nonprofit sector that they are feeling overwhelmed and are unable to meet all of the needs across the country. We see that people don't have
feedback. I'm sorry, just one moment. We're getting just a little bit of feedback. So if you're not speaking, can you mute your mic? Thanks.
So we are seeing that folks don't necessarily have their own resources to be able to go through the recovery process, which is suggesting that there is perhaps a larger role for government here. And when we look at those recovery programs through FEMA, through HUD, that operate at that for the purpose of rebuilding individual homes, we see that people very often tend to navigate those programs. They can be very complex. They take a long time. There are issues with the speed of dealing with insurance companies and the National Flood Insurance Program. So I would say overarchingly, to create a more efficient recovery process, we need to be doing more to streamline those individual and household recovery programs. But also we need to make sure that when people are going through recovery, they are integrating mitigation efforts into that. There needs to be, a speedier process for buyout programs, a speedier grant process for lifting homes up. And of course, ideally, we would be doing those mitigation efforts before the disaster ever even happened. But to the extent that we can incorporate that into recovery, certainly research supports that that is the best approach.
I'd just like to take 1 minute to talk about the important role of trust, which has been raised previously. Most individuals trust their local governments or their local policymakers. And I think that people are looking to make decisions about whether or not they're going to evacuate or whether they are likely to be checking in local policymakers and emergency management teams. So I think it's very important, whatever might happen at the federal level, we need to make sure that local emergency management personnel are getting the best recommendations, are getting the best information. They're receiving it quickly. And I know that, for example, during the pandemic, this is a big challenge of getting the correct information out to the local governments so that they can then deliver that content to their residents, because ultimately it's about trust. And if people don't trust the communications and they don't trust the communicator, it doesn't matter really what science tells us.
Absolutely. Thank you all both very much. And with that, I will yield back, Madam Chair.
And now I recognize Representative Bonamici for 5 minutes.
Thank you so much, Chair Cheryl and Ranking Member Marshall, and thank you to our witnesses. I don't know if Mr. Lucas is still in the hearing, but I do recall having many conversations about the value of social science research when we worked together on the Weather Research and Forecasting Innovation Act. It's so critical. So I represent a district in Oregon. My home state has seen wildfires at unprecedented rates this year. Nearly 1 million acres have already burned in the past month as a result of historic winds and dry fuel conditions. For comparison, on average, approximately 500,000 acres burned each year during an entire fire season over the last 10 years. And unfortunately, we've had air quality that has surpassed hazardous levels that further endangers the health and livelihoods of those already at risk from respiratory issues from coronavirus. It was also incredibly stressful. A lot of people were relieving their stress during the pandemic with a walk through the neighborhood or the park, and they could not go out. Many Oregonians have been placed under evacuation orders, hundreds have lost homes. We're very grateful to the state and federal agencies that have made life-saving measures a priority, but the road to recovery is going to be long and it's going to be challenging. Many experts are predicting significant flooding and landslides this winter. As precipitation increases, the soil conditions remain unstable. The compounding crises were not unexpected. In fact, in April, I joined with my colleague on this committee, Congressman Jerry McNerney from California, in calling on FEMA to develop disaster preparation and recovery plans that reflect the challenges of the ongoing pandemic during natural disasters. And I've also joined my colleagues in calling on the White House Coronavirus Task Force to take proactive steps to protect firefighters from contracting COVID-19. So I want to ask Dr. Montano, in your testimony, you noted that disasters do not happen in isolation from one another, and we're certainly seeing that now. Which emergency management research gaps are the most important to address to improve preparedness for these compounding crises within the next decade?
Well, there are a lot of research gaps in emergency management. When we talk about the research that needs to be done, there is some really basic research that we have not had the opportunity yet to do. As a discipline, emergency management is relatively young. There are relatively few emergency management researchers across the country. And so we have significant gaps. In terms of prioritizing those gaps, certainly looking at what we can do to more effectively prepare. Historically, we've had a relatively narrow idea of what preparedness is. We're focused on individual go bags, individual plans, but really when we think about disasters, they require this community response, which suggests that there's much more that we could be doing in terms of community preparedness. So really studying what the most effective and most efficient changes that we could make to our approach to preparedness is something that is critical for us in emergency management research.
And I don't want to cut you off, but I want to get another question in, and I am going to ask you to follow up on the record with some specific recommendations about that, the research gaps. So we know that disasters often exacerbate inequities for our frontline and vulnerable communities, especially low-income communities and communities of color. We have seen that with the pandemic. So I recently joined my colleagues on the Select Committee on the Climate Crisis in releasing a climate action plan that supports community-led, voluntary, just, and planned transitions from the riskiest flood and wildfire-prone areas. Our plan will help provide communities with information on future climate risks, technical assistance to communities to help them plan ahead, and also funding to help those who are ready to move to safer ground. So, Dr. Montano, what steps could Congress take now to support proactive rather than reactive emergency management, and how can those efforts best support our environmental justice communities?
You know, one issue that we have across the country is that many communities only have a part-time emergency manager who kind of doubles as the fire chief. Some communities even have a volunteer emergency manager. So we really need to invest in the emergency management system at that local and state level. And I think that there is potentially a place for federal funding to help fulfill those positions, which would really grow that capacity at that local level, which would also provide much more of an opportunity for those marginalized groups to be involved in those planning efforts.
And that would be a very good investment. I think about Seaside, Oregon, and the district I represent. It took them years to get the resources to move their schools where their young children are learning out of the tsunami inundation zone. Again, a good investment to make sure these communities can plan. And I see my time has expired. I yield back. Thank you, Madam Chair.
Thank you, Representative Bonamici. Next, I recognize Representative Caston for 5 minutes.
Thank you, Madam Chair, and thank you to our speakers. Dr. Montano, I want to start with a sort of a selfishly personal question, if you'll allow me. I'm new to this line of work. I spent 16 years as a CEO, and one of the sort of the things that they beat into you, whether in business school or then when you get PR consultants, is that as the leader of an organization in a crisis, number one, you have to be enormously transparent about what you know and what you don't know. Number two, that as you develop plans to deal with the crisis, to be very clear about how you develop that plan, because as information is always changing and people are nervous, it's important for them to understand your thought process as much as what the information is, so that when new information comes in and the plan changes, they don't get nervous. And then lastly, just to massively over-communicate, because otherwise the rumor mill takes over. My sort of selfish question is, given your expertise, would you amend that plan for those of us in public service, or is that still basically the right way for us to be dealing with these sorts of crises as we speak to our constituents and beyond?
Yeah, absolutely. The research certainly suggests what you explained, that trust, clear communication, excessive transparency is a good approach in the midst of a response to a disaster. Sometimes we see politicians hesitate to be forthright with what is happening during a crisis because they are concerned with creating some kind of panic among the public. In fact, we have research dating back almost 7 decades that supports that people don't panic during disasters, that actually that information is useful for them and leads to them being able to be an active participant in that response and make those really effective decisions for themselves and their families. So certainly, yes, transparency, communication is the right approach.
So my second question then is that it strikes me that politicians are generally good at doing that for crises that are right on top of us. When the hurricane is bearing down on the coast and you got to tell people to put up sandbags or get out of the way, we do a good job. It strikes me that we have done a completely horrible job of dealing with that with COVID. That's a slow moving crisis, which I guess only looks good relative to climate change, that's somewhat slower moving. And too many folks in our line of work are just outwardly lying. Should we adopt a different approach for slower moving crises?
I'm not familiar with any research that would suggest any kind of different approach. I think, again, being honest with the public about what the risks are is the best approach. Again, it's about empowering the public to be active participants in that response. And when you tell people that everything is fine and they look out the window and see that the sky is not the normal color, there is going to be extended trust issues that extend past just that disaster.
Well, so I guess my last question, and I don't know if this is best for you or Dr. Silver, but you've confirmed my own preconceived biases, which is helpful. But if we're not doing a good job of communicating, if we're telling people that you can ignore climate change because it's not real until it's a hurricane bearing down on your house, if we're telling people that COVID is going to magically go away until your loved ones in nursing homes are dying and you can't visit them, what kind of stresses does that, in other words, what are the consequences of us failing to follow these strategies and how people behave? And Dr. Silver, your research on how that stresses people out, what does that do to people when we instead of empowering them to lead, we pile that stress on top of them?
One of the things that we're seeing now with COVID-19 in particular is conflicting information. We are hearing, and individuals are hearing, one message from perhaps one set of leaders, another message from another set of leaders. There's a lot of controversy being communicated via some public health individuals that may be politically driven. This becomes a real challenge, and we found in our research that we just published last week in Science Advances that when people hear a lot of conflicting information, that does exacerbate stress. That does increase the likelihood that people are going to exhibit depressive symptoms. So it's not just hearing message A, it's hearing message A and message negative A. These are the big challenges for us because it's very difficult to know who to believe. And as we see, unfortunately, people are choosing different sources, and that leads to controversies and the challenges that are exacerbated right now.
Well, thank you. I'm out of time and I yield back, but here's hoping we can all take some of your wisdom and take it forward as we lead our own constituencies. Thank you. I yield back.
Thank you, Representative Caston. I now recognize Representative Byer for 5 minutes.
Madam Chair, thank you very much. And this has been really fascinating to listen to. And if you forgive me, I just want to emphasize the link between income and wealth inequality and the vulnerability to extreme weather events, which I think you've pointed out again. I just think the worst Virginia disaster in our lives was Hurricane Camille, 1969. We lost 153 people in a couple of hours. It was mountain slides and flash floods, 21 members of the Huffman family. And it was all relatively poor or low-income people living in very fragile homes that were washed away. Every time I see a tornado on the TV, the people killed seem to be the ones in mobile home parks. When floods kill people, they tend to be living in flood zones down along the river. Even earthquakes, it's the lower home values. You know, was it 2009, we had Haiti that killed all those people as the homes just collapsed. A few years later, we had a 6-point-something Richter scale in Virginia that didn't injure a single person because of the difference in construction. So it's our commitment to economic growth for everybody, to overcoming the systemic racism that's shown up in 10 and 12 time multiples for the net worth between an average white family and a black family, or a white family and a Latinx family. That economic justice and environmental justice are basically the same thing. Dr. Silver, in your study on the Ebola pandemic in 2014, you noted that people who consumed more media about the crisis were more afraid of contracting Ebola, even though the risk is relatively low. How do we interpret that in the context of COVID-19 when we want people to know that social distancing, mask wearing, don't go inside a restaurant, all these things are so important in balancing that with the fear of contracting the virus?
So you raise an extremely important point, which is that the media is a double-edged sword. It helps us communicate the protective actions that people can take. It's a very important way to get information out. But at the same time, we know that many media outlets want to keep viewers, keep people watching, and the stories that they're telling are all bad news all the time. So what we're talking about in terms of media exposure is media about bad news, sad stories, graphic images, which we haven't seen, fortunately, with COVID. But we did find in our paper that just came out that, in fact, the more media people were watching in or engaged with, either in traditional media or social media, in the days after COVID began really hitting the news waves in the United States, the more media people were watching, the more stress they were reporting, the more depressive symptoms they were reporting. So if we were only delivering content that was providing information about health protective behaviors, that would be one thing. But as you know, the media is filled with all sorts of other conflicting messages and controversies. And so it's not as simple as just saying, we understand that the media can be good. It's a double-edged sword.
Dr. Montano, let me pile on with that too, because as Dr. Silver mentioned, we've had tripling of people diagnosed with depression, anxiety. The frightening statistic that a quarter of young people 18 to 29 have had suicide ideation since the beginning of this. How do we better communicate the need to get out of Dodge before the volcano blows or before the hurricane hits, or to take the protective actions and not push people into these depressive states?
You know, one thing that I think is really important here is making sure people have the needed resources to actually protect themselves. When we look at some of the research post-disaster, we see increases of domestic violence, we see increased stress, we see increase in suicide rates, and much of that seems to be tied to the actual stress of the post-recovery community and not having access to resources, not having access to jobs. So the things that we do in emergency management ahead of time in preparedness to ready our communities to better withstand these disasters, I think could have a benefit on those mental health repercussions in the aftermath.
Thank you very much. Madam Chair, I yield back.
Thank you. And at this time, I'd like to open it up for any members who would like another opportunity to ask questions. Does anyone have any further questions?
I love the idea.
Other hands, I'd like to recognize Representative Beyer for 5 minutes.
Thank you, Madam Chair. I think I think, Dr. Montano, it was your notion that we need to make FEMA an independent agency and give it cabinet level status. Can you expand on that a little?
Certainly. So prior to 9/11, FEMA was a cabinet level independent agency. This afforded them a number of useful things, namely a direct line to the president when a disaster did happen, and a greater stature among the other federal agencies that are, of course, very important to much of what we do in emergency management. Post 9/11, as DHS was proposed and created, FEMA was incorporated under the department. At the time, there were former heads of FEMA, James Lee Witt, and other disaster researchers who warned that doing so could inhibit FEMA from meeting the needs across the country. Since that time, though, however, FEMA has stayed put, and there have been times where there were potential concerns about how well the administrator of FEMA was able to connect with the president and the White House, and just the overarching role and responsibility of FEMA within this huge department. So moving forward, as we think about changes post-COVID to our emergency management approach, to our public health approach, I do think that perhaps it might be wise to reconsider this idea of FEMA being an independent cabinet level agency again.
Thank you very much. I yield back, Madam Chair.
Thank you. And do we have any further questions? Well, before we bring the hearing to a close, I want to thank our witnesses for testifying before the committee today. The record will remain open for 2 weeks for additional statements from the members and for any additional questions the committee may ask of the witnesses. The witnesses are excused and the hearing is now adjourned.